Albina, the first one is you. I mean, any question to Dr. Albina?
I have a question for all of you.
Okay.
You're plastic surgeons sitting here. So my question's to you, because all the time we see in social media, for example, some of plastic surgeons, they're saying, oh, don't use thread lifting, because after that it's impossible to do a facelift. So I'm interested in opinion of each of you.
Thank you for the question. What I basically believe, of course, it's not, you can do a facelift after thread lifting. And of course, thread lifting is a very powerful tool for those patients that do not want to have surgery. And I've seen some great results today by thread lifting. The only thing that I would like to say is that whatever that either the plastic surgeon or the dermatologist, whatever he does in his practice, he must be extremely well trained. So if he does a facelift, he must travel all over the world, visit many plastic surgeons to see what are the techniques he produces the best results with, keep them, and keep evolving. The same way with non-invasive treatments, whether the injectables or thread lifts, he must visit many plastic surgeons or dermatologists in his country or around the world. He must come here and visit Dr. Sulamanidze, Dr. Kajaya, and learn how to do it correctly. If he does it correctly, then he might have these incredible results.
Thank you.
I think we have to analyze two things. First, that when the thread started, I don't know what, now almost a decade, and then the progression of these threads, we've seen that the practitioner who's using thread, they are also changing slowly. What does it mean? It used to be like I see patients where they have hundreds of thread in their face. And some practitioners, they just use so much of them. I'm not going to mention which kind of threads they're using, but you know, the techniques and the threads technology, as well as the new production, has changed. And I agree with my colleague Dr. George here that, you know, we need to refine the use. It's not necessarily that you come to a plastic surgeon, no. There are a lot of experts in the field, and the less thread you use to get your result, that means you are more expert and more precise work. And that will basically produce less of the issues fibrosis we see. I myself, I experienced facelift surgeries where patient had threads and it was mixed. Some of them were very easy to dissect and to work with, and the other ones was horrible because of the quantity and the number. And the worst part, what I saw once in a rhinoplasty, that patient had more than 50 resorbable threads in their nose. And the picture, if you can see,
was a big nose.
it's actually not a very big nose, but I mean the amount of it is like a micro ones. And if you see the picture, once I elevated the skin, the number of the threads was I couldn't find a normal tissue anymore. It's extremely difficult and very cautious. And the problem with the nose, like, you know, every millimeter will show the results in a different way. So it's not easy. And as I said, like, the more precise work that any doctors do, that means there will be less consequence as a bad consequence for themselves or also for other practitioners.
You know, the fact is, you know, the world when treating the face, if we do, you know, statistics, we know that there are more dermatologists and aesthetic doctors than plastic surgeons. This is the truth. All right. So the fact is, to choose the right technique is the most difficult thing. If someone is aesthetic doctor or dermatologist and he's honest and he sees a patient and the patient needs maybe a facelift, sometimes he doesn't send to a plastic surgeon, and he does, you know, because he has been here in Georgia and they said, just if you put the 2 threads, you won't have the same result. I think, to be honest, is the most difficult thing, you know, in our job, because we have limitations. We plastic surgeons, doesn't mean we have also limitations because we don't go into threads as we have to do. The fact is, as you know, nowadays, has become a new trend is a lot of skincare about neocollagenesis, etc. And it's true that if you do a lot of radio frequency, ultrotherapy, and even threads, it's true that you have not really sometimes a neocollagenesis, but sometimes you have, even if sometimes there's a big debate on that, it's fibrosis. And the problem is that the dermal plexus diminished, the vascularity of the dermal plexus. So what happened? Nowadays, the deep plane technique for the facelift has become popular, even if it's a very old technique. Why? Because we surgeons, we are scared about to undermine the skin and to have, necrosis. So the fact is, the end is, now I have seen, my colleague doing, threads very deep. And I have to say that my only consideration to you is that you have excellent results, but need a very excellent training. Because when you make, the threads, along the neck, and you mentioned that you go under the platysma, we know that when you close to the platysma, we have the jugular vein. And then he knows, because he's an excellent surgeon, but now you have seen, these excellent results on the mandibular line, excellent, but this mechanical effect. But if you go below the platysma, it's not related to the nerve, but it's related to other structures like the, like the jugular vein. And maybe you have simply an hematoma. The fact is, just to make a resume, is whatever you do, you know how to do it and when to do it. And this is the most difficult thing. If you have to use threads, use the best, and of course, we are here. But even if those threads are the best, if you don't use on the good way, you won't have the result you pretend. And then you're going to call, Constantine and saying, Constantine, you sold me, these threads and they don't work. And it's like when someone uses a filler, saying, it's Galderma who's bad. No, it's not Galderma, it's you, because you don't know how to use it. So this is, I think, the most important thing.
And first of all, to clarify, if I go deep here, it's a disaster. It's over the platysma here. It's subcutaneous to create the hammock effect. But on the other parts, it's deep. So for your question, of course, a facelift after thread liftings is not the same like a virgin face. But it's not that difficult. The only thing that we should deal, we have to learn the techniques for this kind of patients. We have learned how to remove the previous fillers first. And we learned how to deal with the patients who had ultra-therapy in the face, in the neck area. It was disaster at the beginning. Now we have to learn how to deal with the pre-treated patients. And then it's not a problem because I used threads and the surgery, and sometimes I offer threads to my surgical patients because they're not the perfect candidates for the facelift. I tell them, you try this one for 1 year, 2 years. If you like the result, you'll come back to me. Too money for me. That's better. That's even better.
Thank you very much. First of all, I want to say that such kind of sessions are extremely important for both for plastic surgeons and dermatocosmetologists. And I think that any conference about plastic surgery, dermatocosmetology, needs such sessions about surgery after the minimal invasive techniques, about the minimal invasive techniques to improve the surgical results. And this could give us possibility maybe to modify even to modify more some thread lifting techniques. We know how to do thread lifts in a proper way, in a safety way, but maybe after such kind of sessions, after some articles, some researches, we will have even more information about that. Or maybe we can think about non-classical cases of facelift when we have great lectures of our colleagues, plastic surgeons, and in most of the cases they are speaking about the native faces, they are speaking about the facelift in normal way. Maybe they will speak even more about the facelift is after the minimal invasive techniques, and maybe they will all give some small recommendations how to deal with this method, because more time will go and more cases like this we will have. And the experts like this are sitting now here should give us more, should give to everybody more and more information, because a lot of new plastic surgeons, a new generation of plastic surgeons are coming. For example, yesterday, Professor Kirill Pshenisnov, he said that now in Russia it's more than 1,600 residents of plastic surgeons now. So that means that in nearest few years, Russia will have more than 1,500, 600 doctors. And of course, it's a big competition there. And of course, many of them will do everything to have more and more patients. That's why, to stop this chaos about this stem, we should speak about this more. A little bit I turned to the other way, but I want to mention that such kind of sessions are very, very important on any congress.
I agree with everything that is said. I just wanted to add something. I believe that being sincere to our patients, so if we see something that must not be done by saying no, for example, if a plastic surgeon says, you do not need any more fillers, or if a dermatologist, like you said, says, now you must do a facelift, find a plastic surgeon to do a facelift, this is very important, of course, ethically, from an ethical point of view, and we must do it, but it doesn't harm us professionally, because this one patient that will go home and tell her 5 friends, I went to that doctor and he said no, those 5 friends will come after a year and they will say to you, I came to you because I know that if I do not need something, you will not perform that. So it's not just an ethical point of view, which is the most important thing, and professionally, it doesn't harm us, it does good.
Thank you so much. Really, very important words. I think we should be much more in interactions, dermatologists and plastic surgeons, yes? Because for us, sometimes, yes, exactly agree with you. So fillers is not a solution. Yes, I understand maybe some of the patients, they are not ready for the surgical intervention, but first of all, we need to explain to them. For example, like blepharoplastic. There is no cosmetic solution for improving of this problem, yes? And in case of the surgeries, yes, we can provide a good like options, like a threads, yes? For example, in my case, I'm 40 years old, I did 3 times threads. I'm not sure that I'm going for the facelift, but anyway, why not? Why not to prolong the result? Why not to improve this anti-aging? Maybe in combination, maybe in education, but much more in relationship between plastic surgeons and dermatologists. And in this case, there will not be like myths and fakes that surgery is bad, or threads is bad, or fillers are the bad. No, everything should be done, but in the proper way.
There's something that's the worst thing in life, what it is ego.
Yes, exactly.
Okay, ego. And the problem is that if we are honest, as I said, to be honest, a plastic surgeon trained is a plastic surgeon, is not a aesthetic surgeon yet. All right, this is the first thing. I have been doing a brachial plexus injury for 5 years, during my training, and did not liposuction. All right. So, but I am a plastic surgeon. I have my diploma, and then I can do anything. This is not nice. So the fact is, we need to be anyone need to be honest with their backgrounds. If you know how to do it, not because you have a paper, doesn't mean no. Because even there are a lot of plastic surgeons, they have been doing burns for 5 years, 10 years. What about, filler? So the fact is, I think it's very important to be honest, your ego on the pocket, and then dermatologists know how they work. Even dermatologists, if you do clinical dermatology, you don't know nothing about fillers. You know about psoriasis, you know a lot of things. So that's why we have to change our, this paper on our mind, on our head, not saying we are. No, we are nothing. we are going to be. So that's why what you mentioned, about, to make this kind of, of round tables is good, but to be clear, to show, and not to say because I am, you are nothing. I mean, because you don't know how to do. And then you show the cases and they say, oh, okay, you have a paper, but I won't trust you. And what you mentioned about the fillers is, I completely agree. Those, don't use fillers, because fillers, you're going to have, of course, if you don't know how to use the fillers, you will have these problems. It's like to do the facelift. You remember the facelift when you have, this demi-moved facelift? It was horrible, but then it has been redone. So the fact is, again, ego on the pocket.
I can't actually agree more on this one. And I think, Dr. Javier, you nailed it, that we have to know where is our limit. And for years, I've been fighting that, if you look 5 years ago or 10 years ago, you will find plastic surgery conference, there will be only plastic surgeon. If you come to the dermatology conference, only dermatologist, and they will not accept anybody else to come there. And I thought this is a big mistake. In the end of the day, we are all physicians and doctors. And we need each other. No matter what discipline you are, no matter what expert you are, you will need your colleague from other discipline one day. And we have to know that, okay, I'm a plastic surgeon, I can do some of the things in a different way, but I might end up with a problem where I need dermatologist, or I need ophthalmologist, or I need a general surgeon to open the abdomen, or even cardiothoracic. Same thing, in the dermatology, they might have some issue and complication that they will need another discipline to work together. So again, we should know our limits, and we should be basically open our doors and our chest to everybody. I'm a president of Plastic Surgery Society. I'm a vice president of dermatology and aesthetic medicine, and vice president of surgical and medical regenerative aesthetic. And the reason why I've been through all this, because I want to open the doors that in a medical conference, everybody's welcome to come and learn, regardless what's of your discipline. And I'm very happy also to see here in Kolkhida, same idea from the family that, we are here to open our doors to anybody, to all the practitioners to come and learn from each other. And if we have this kind of model, I think that we will be much easier for us. We will not feel like threatened by other ones, or they're taking patient from me, or I'm taking patient from them. It's not. In the end of the day, you're going to get your patient that you're going to serve the best, and the one who you think that your next door doctors or clinic, they can do better, send them there. Because the minute you send them, then later on they will come back to you, and they will even bring more patient to you. Thank you.
That's right. Exactly. 100% agree. And main criterion of the method that we are choosing is the indication of the patient and expectations of the patient, not our limitations. I completely agree that if we are limited with some procedures or surgeries, we should have the friends in other specialties and collaborate, because finally the successful doctor will be really successful when patient will be satisfied, not only the procedure and the result, also the activity, I mean the way how you work with them. Even if you will not do some procedure for them, but you will give a correct advice and correct direction, then you will have even more patients in future. This is the way. I agree.
I think sounds amazing. And many thanks to all of you. Thank you for coming, for sharing with us your knowledge with using non-absorbable threads. Well, for many, many years in the same session in all over the world, on all congresses. And I think we changed, let's say, the trends, yes? Because even 20 years ago, nobody was believing in threads. Today we are talking about threads. Yes, they exist on the market. We have permanent, we have absorbable one. We are combining it with a surgical intervention. We are combining with injectables. And yes, everything is doing for the patient satisfaction, first of all, and safety. Thank you so much for your session. Thank you, participants. And as I know that Aptos has prepared something, yes? Not for us, not for us. We're free. Not for us, yeah. For us, it's going to be a gala dinner. Yes, please don't miss gala dinner. This is a highly recommendation for all of you, because after that you will miss the time.